And he is always just a phone call away. He responds so quickly to all of our needs. And you have done just an exceptional job. I think by far the freshman of the year. And we're just so grateful to you for helping us in every way. We love your sweet family and all that they do. We were cutting a ribbon the other day for Upward Hope Academy and a project that they're doing. And I stated then at that ribbon cutting that school and those dreams would probably not be a reality if it wasn't for Macy and Maze and all of the just quiet things that they do when no one's looking. So they're just phenomenal people, treasured friends, and thank you so much. I know you're so busy, but thank you for taking time out of your day to spend it with us. We've got lots of questions, but I think what'll work best is we'll just let you report, and I think Lorraine does have maybe some housekeeping things to discuss, but we'll let you report, and then we'll ask the questions that were submitted, and then we'll let people ask questions from the chat room. Is that okay with you?
Thank you, Gina. I sure appreciate you setting this up today. You know, it's been great to see our community come together, our state come together, and our nation really as a whole come together to respond to this. And you know, it's certainly a crisis we've never faced before. We've lived through hurricanes. I think that's why like the Galveston Chamber has done such an awesome job. We've been through disasters. You know, this is definitely a different kind of disaster, but we are used to responding to disasters, and it's all hands on deck. And, you know, we've seen everybody all the way down to community banks are implementing some of the federal programs that we're seeing right now. And then, you know, we have people in high school that are sewing masks, and you know, our Texas Tail, you know, distillery making hand sanitizer, you know, so it's amazing to see all these things happening in our community. And really it really is almost like a wartime effort at this point.
Yes.
You know, just later tomorrow, actually, before I kind of get into it, you know, one of the biggest things that I keep hearing for people is unemployment claims for unemployment benefits. And I think our previous daily record was 60,000 claims in one day, phone calls, and we had 1.7 million last week, you know, which means we have a lot of work to do. So as part of that, the Workforce Commission is essentially deputized all of the legislators' offices to become claim processors. So tomorrow, my office does our training to start processing those unemployment claims and helping with this all hands on deck effort. But kind of before we go into that, I wanted to go into more detail into that a little bit later. You know, our Galveston County Health District has been doing a great job keeping us updated, where the cases are, how many tests have been administered, who's been hospitalized. You know, yesterday, obviously we've got about 275 people now with it in our county, and we have about 25 hospitalized. 6 of those are hospitalized at UTMB currently in Galveston. That was as of yesterday evening's numbers. That may have changed this morning. Good news is we're getting the amount of personal protection equipment and testing that we need. Over the weekend, Dr. Raymer told me that UTMB in Galveston got a shipment of ventilators and personal protection equipment from the state, and they feel like they have sufficient quantities now to get through this first crisis phase of this virus. So they're actually starting to help with some of the nursing homes. So, you know, we all know that one of the biggest tragedies in this is that it got into one of the Texas City nursing homes, and 83 were infected, and some of our deaths, you know, we've had 5 people pass away so far. I mean, these are people's moms and dads and grandmas and grandpas, and you know, it's a tragedy. And unfortunately, it did get into one of the nursing homes, and so UTMB is helping with that. They're lending them some of their personal protection equipment. They're also training some of the nursing home staff on better ways to prevent the spread of this virus. So hopefully,
Did we lose the sound?
And go back to Maze here. Hang on a second, Maze.
You've got Maze muted, I think. He's
That's-
muted.
Shouldn't be, but yeah, I don't know how he got muted. Okay, now he should be unmuted.
Nope, it still shows him muted. Hold tight.
Yeah. I think it's the internet. We're stuck.
Sorry, you guys, it's stuck and won't unmute.
Okay, if those of you that have your video on, if you could turn it off, that would probably help. That might be what's happening. Let's see, I can't even get to him right now. Let's see.
Sorry, Maze.
Maze, can you see if you can unmute it on your end?
okay.
There.
Can you all hear
There
me
you
now?
go. Yeah, there you go. We're back.
Okay, all right, I'm sorry about that.
No, it wasn't your fault.
We're
There
all,
you
we're
go. You
all,
just got a lot of people watching.
Yeah.
we're all
Got a lot
learning.
of people on there. Yeah.
Yeah.
Please do turn your videos off, you guys. There you go. Thank you. 'Cause
So
that-
locally, you know, testing is ramping up. Governor Abbott announced that we've already received our first 10,000 of the quick tests. Those are the 5-minute tests. From here on out, we should be getting about 20,000 of those per week. Those will help a lot, especially with our frontline healthcare workers, and will also work well with the way, you know, UTMB has set up their patient intake. So they've separated out, you know, their ER essentially for their standalone ER, and then a triage area for people that are showing symptoms. So that helps prevent the spread of this. So that will be a big help. Longer term, you know, we're hoping to develop here soon an antibody test. That's really mainly for people that haven't shown symptoms, because right now we are reserving the test for people that are showing some sort of symptoms, right? So
Right.
that's the official recommendation. We need to make sure that we're practicing, you know, our social distancing, gatherings of 10, don't do it. We really need to flatten this curve. It looks like it is flattening though. The trajectory of new cases seems to be starting to level down. We're doing the right thing. You know, it's working. We just need to keep at it. And then at that point, once we do get it flat and start to go down, we need to, you know, make sure we do everything we can to put our economy back to work. You know, it's a lot easier to shut it down than it is to restart it. So that's what I'm gonna get into a little bit later in this meeting, and what we can do there and how we can help, and how the federal government and state government is helping, and local is as well. Local government is helping also. You know, one other issue on the on public safety, cruise ships. So there are several cruise ships out in the Gulf. We're servicing 2 at a time in the port. I know there was some concern about that. There are no passengers on those cruise ships. And when they offload crew members, they don't get off in Galveston. They're shipped straight to Louisiana to the airport under armed guard with Customs and Border Patrol. So I know there were some questions of our cruise ship crew getting off into our community. No, they are not. They're being tested, and we also have very strict quarantine procedures with the Coast Guard on if any symptoms are being shown and they're not critical, meaning they don't need immediate emergency care. They have to be quarantined on the boat, stay on the ship. So we have a bunch of safety protocols in place to make sure, because, you know, each one of the cruise ships has more than 1,000 crew members. So I know that was a big concern that I heard from a lot of people in Galveston. So the Coast Guard has been on top of that, and I've been working with them, and the city's been very helpful in that as well, making sure that's handled in the right way. And, you know, just moving forward, the federal government's response so far, I think, has been good. A lot of people have applied. You know, there are 3 main programs to apply to at this point. One of them is the SBA loan, and that, you can get a $10,000 grant within 72 hours of application. So I know some people applied before, like a couple weeks ago, before that actual program was implemented. You need to go back in your application and make sure that is properly applied for, because you should get that $10,000 grant within 72 hours. The other one is the Paycheck Protection Program, and that one is designed to keep people employed in this crisis. That's the biggest problem. Is, look, I mean, for businesses, is they've been shut down. I mean, we have government orders for shutdown, and it's for public safety, but that doesn't mean that we really need to do everything we can to make sure that on the other end of this, these businesses stay in business. And that's really the main goal of the Paycheck Protection Program. Is you can take out a loan, but the portion of the loan that's spent on payroll, and it's more than just payroll too, there are other expenses that you can allocate to that, like healthcare. You can even allocate some rent. I think the max of that grant that can be forgiven outside of payroll is 25%, I believe. So, 75% of that grant's got to be payroll, and that grant covers 8 weeks of payroll. But the loan can go on for up to 10 years. So good news is that it can carry out longer than that. And that's a $350 billion program. It's not going to run out of money. If it does, they plan on putting in another $250 billion. A lot of Texas businesses have applied. Mm-hmm. The best part about it is that our community banks are administering this program. So yes. I know Gina and I were talking earlier about Texas First. I think they've done over $41 million in loans, saved over 4,000 jobs. The little community bank that I'm on, First Liberty National Bank, has already made $15 million in loans. And this is to keep people employed and keep businesses in business. I mean, we've never lived through this before in a downturn, a depression, a normal recession. We see our revenues go down. We've just never seen them eliminated like this before. I mean, this is completely unprecedented. So we've got to keep businesses in business, and that's why that Paycheck Protection Program is there. And then there's also a payroll credit. So I can go into that one a little bit. And it's important to know for the payroll credit that if you do that, you cannot do the Paycheck Protection Program. So that one is very important for people to know, that if they elect to sign up for the Payroll Protection Program, then they cannot do the payroll credit, and that's up to 50%. So that program runs through the end of the year, the payroll credit program. And so that goes on longer, obviously. The payroll protection grant, I believe, ends June 30th. Mm-hmm. So that 8-week grant program ends June 30th. So you kind of have to decide which one is best for your business. There's a good SBA. I think Gina has sent it out on the chamber email. The Senate Committee on Small Business Entrepreneurship put out a bulletin on kind of what works for you. There's actually a good Forbes article that I can share with the chamber as well, that kind of goes into it as well, like what is the right thing for your business.
That would be very helpful.
Go the PPP route or the payroll tax credit route. Those are two different separate routes that you can take. You're still eligible for the SBA loan. That's a longer term loan. That's a 30-year loan. So that's always available on top. But when you do take the SBA loan, you can't use the proceeds from the SBA loan on the same payroll protection if you sign up for the payroll protection program. So those two you can't get double there. In other words, you got to decide on that one as well. So there's a lot of fine tuning in this. A lot of it is, we are building this plane while we fly it. I'm impressed that we were able to, get these things implemented as quickly as we did. You don't usually see that, but that shows the magnitude of what's going on, because, Texas led America out of the Great Recession, and we can do that again. But, I've seen some numbers, and, possibly we could be at 15% unemployment. The Great Recession in 2009, we were at 10%. We could see 30% decline in GDP. I mean, those are pretty dramatic numbers. I mean, these are things we haven't seen before, because the benchmark you got to keep in mind is in the Great Depression, we had unemployment of 25%. So reality is we're going to be somewhere between the Great Recession and the Great Depression. And a lot of this, the virus has played a role in it, but government shutdown is really one of the biggest roles in it. So we need to be there to help, and we are there to help you. We want to help you get through this. We want to help people get through this. So that actually leads me to unemployment. So I had some facts and figures there. I think y'all are all aware that Governor Abbott, there's some normal requirements that have been waived. So, you got to wait a week. Normally that's been waived. There used to be a work search requirement. That's been waived. And then also a lot of people have had problems getting through to claim their unemployment benefits. And that has partly been fixed by allowing you to backdate. So, if you couldn't get through till tomorrow, you can backdate your unemployment benefits to the day that you lost your job. So that's a big change. There are also some designated call times that I think everybody needs to be aware of. So for us, our area code begins with 409. So that means that our suggested call times are Monday, Wednesday, and Friday, 1 p.m. to 5 p.m.
That was a good idea.
Yeah, so we have, by area code, those are designated call times. So just FYI, everybody try to remember Monday, Wednesday, Friday, 1 p.m. to 5 p.m. for our area code, or the designated call times at the Workforce Commission. And, the Workforce Commission has done a lot to add employees. They've hired 100 people in their call center. They've transitioned 250 people from their audit department to answer phone calls. They've also transitioned a bunch of people from other admin roles within the Workforce Commission. But like I said earlier, the good news is that they've deputized every state representative's office and state senator's office, which we will be trained in tomorrow. So after tomorrow, hopefully everything goes right, we'll be able to process those unemployment claims. And there's also been an extension. The federal government added $600 weekly as the cap on unemployment benefits, and then also extended unemployment benefits 13 weeks from 26 weeks. So these are some of the things that we've got to do and make sure get fully implemented to get people through this crisis. Because, Galveston, we're a service economy. We've got a lot of restaurants that are having trouble. We got a lot of retail shops that are having trouble. We have so many businesses that are related to tourism that are having trouble. I mean, we see, like the cruise ship industry is shut down all the way through the end of May, and it's probably going to be longer, and once that door opens, and we say go and everything gets to reopen, everything's not going to be at 100% capacity. And that's why the Paycheck Protection Program is so important, to keep people fully employed, where we have these businesses and continuity of business. That's what it's really about, is continuity of business.
Yeah.
And that's what we want. So I know there's some questions also on business interruption insurance.
Yes.
I was very disappointed to hear that a lot of the insurance companies are denying business interruption claims. I can't imagine this is basically the perfect case for business interruption insurance. I mean, for years, people have paid that, and most of them have never made a claim. So I plan on sending a letter to the Texas Department of Insurance asking for an investigation why so many claims have been denied. I've heard from the restaurant industry that 99% of business interruption claims are being denied.
Yeah.
I mean,
well, we were told that, I'm sorry, we were told that too, that it wasn't considered an act of God. And so that it didn't apply to any of us, even though we've paid that, and all our businesses, they have called and called, and they're so upset because you pay it, like you said, every year faithfully. And when you need it, it's not there.
To me, this is the classic case. This is damage to property, right? Because you were counting on revenue that you're entitled to. That's your private property as a corporation or a small business owner or sole proprietorship. And you were counting on that revenue, and it's not there anymore. And that's the whole point of business interruption insurance, is to make you whole with your revenue and then also with your ongoing expenses. I mean, that's the whole point. So anyway, I plan to look into that. It may be that we need some legislative changes next session. We probably will. to make sure people are covered, because to me, this is wrongful denial. It's wrongful denial of people's claims. They need to be covered. Those claims need to be paid. People have paid those premiums over the years, and they deserve their claims to be honored.
Yes.
I'm very disappointed that they're not. That's something we've got to work on. And it is just, it's a non-starter for me. We got to fight that fight. I'm going to keep fighting that fight. So I know that's really important to a lot of the chamber members, because I mean, we thought we were covered, and then I've heard from so many that said, no, we're not. And they, it's too bad. They're going to have to maybe do things they really didn't plan on doing, and take on debt they really didn't plan on taking on, because those insurance claims are being denied. And one of the other things that I really wanted to talk about is our community response, which I've been incredibly proud of. It's been awesome to see what's happened in our community. Like Texas Tail I talked about earlier, in our homegrown distiller on the seawall, will produce 500 gallons per day of hand sanitizer. There's a student named Austin Montalbano that, he'd never sewn anything in his whole life. And he and his mom started making masks, because, we're still in short supply on masks. We really are. Now, the recommendation I know is that CDC recommends that people wear masks out in public. I don't have any, because we gave all of ours away to home health care and other people that really needed them. But it's my understanding that the main benefit of that is the homemade masks aren't necessarily going to prevent you from getting the virus, but if you're asymptomatic, they'll prevent you from spreading it. So that's the benefit of the mask. So that's why it's so important, the things like Austin Montalbano is doing, and Tech City High School student. He's made over 100 so far, and our community banks are leading the charge on responding to this crisis, making loans. I think the first loan, it's my understanding, the first day that it went into action, the first loans were made at 5:30 a.m. They're right into work, so they're there every day. And I think that's a great setup to allow our community banks, like, it's really like Moody, like Texas First, like Hometown. I mean, there's so many, to have them implement this program, because they're part of our community, they care, and they're going to make sure it's done right, and they are. And it's amazing how many jobs they've already saved. And it really goes further than that. So like, I saw that Texas City and Lamarck as well have used their EDC money, that's their economic development money, to provide grants to small businesses. So both Texas City and Lamarck are providing up to $25,000 in grants to small businesses in the community. So they have to operate in the city. So Lamarck EDC for Lamarck businesses, Texas City for Texas City businesses. And it's amazing to see that money, that is tax money, and they're using it for the exact right way. They're there to help businesses in the community, keep people employed during this crisis. And I could not be more proud of them for doing that. I wish that all local governments that had an EDC would do the same. That's the exact right thing to do. That's why it's there. It keeps people in business, and I'm incredibly proud to see that happening, and to see those cities step up to the plate and become part of the solution here. I mean, it is truly all hands on deck, and that is Exhibit A of it right there. They're helping businesses stay in business.
When I spoke to Jenny, who's the president and CEO of Texas City Mark, and I just thought that was so brilliant. And the fact that it's a grant, and the fact that they can walk in and get that money so quickly. And I'd sent an email to our executive committee too. It would be wonderful, and I know that you'll agree, if the IDC and some of the money that comes through our 4B tax, that would be such an incredible use of that money to go back to these local businesses as a grant. I mean, I know there's a lot of priorities, but getting our businesses up and healthy, I just think would be a brilliant use. So
I think we
maybe
should
you can help us on that.
I think we should, because, sales taxes are generated from commerce in our community. And, those businesses may not be there to generate those sales tax anymore. So we need to come up with solutions like this to help them. It's not, there's no silver bullet, right? I mean, just signing up for the PPP program is not going to save everybody.
No.
There's so many so much fine tuning, and there's so many different types of industries that are hurt, in this downturn, that it's going to be, we're going to have a menu. We need every tool we can have on the table to help people get through this. It's just a single tool is not going to help. We need a lot of them, on the table to help people. So, that's part of it too. So, unfortunately and fortunately, the state cannot print money like the federal government. So we are required to have a balanced budget, but there are things that we can do. So, I requested that the comptroller waive penalties and interest for late sales tax payments, and he granted that for March.
Thank you.
I expect that to be the same for April. So what that means for all the businesses out there is file your return, don't pay, but make sure to call the compliance department and enforcement department of the comptroller to work with him, and then they'll waive penalties and interest due on your sales taxes. And look, I get it. The argument is, well, they collect that on behalf of someone else. I'm like, I understand that, but they have been put out of business by order, right? This is not like the 2009 downturn. We need to help them, and that will help businesses get through this. So I expect that to continue. I did get that question. I think you sent it to me about what do we do about April. Same thing. Do the same thing as March, for March sales tax collections, and file your return. Then call the enforcement line. I think I sent it out by email a couple weeks ago. I can resend it if people need it again.
We'll send it back out. Mm-hmm.
And they should waive penalties and interest. And franchise tax too. That's been postponed. I believe that was due in May. That's been postponed to July. So that's the same as your quarterly estimated income taxes. Those have been postponed to I believe, July as well. So those franchise taxes due have been delayed. And they'll be due the same time as your income tax is due with federal income tax. We don't have a state income tax, thank God. Your federal income tax is due in July. I also got a notice from FEMA that they extended the grace period for flood insurance renewals, which is good news for us on the Gulf Coast. And they have added from 30-day grace to 120 days. So that's from February 13th to June 15th. And then I also have something from TWIA. It's hard to believe they'd actually do something helpful for us, right?
I saw that same thing.
Yeah. I guess I'll believe it when I see it. But they did say that they implemented a temporary payment option on April 1st. And that will reduce the amount of premium due in order to issue a policy. And it provides 75 days to pay the remaining premium, right? So these are some of the things, this is just cost of living on the Gulf Coast, cost of operating on the Gulf Coast. So we do have some delay on our flood insurance. We have some delay on TWIA. So far I know I've had the question also from the quarterly property taxes due. I talked to Cheryl Johnson's office on that. And basically what she said is so far we don't have a waiver on the quarterly property taxes due, but because her office is closed, she said that the only extension that exists is that all payments that were made by April 6th, so April the 6th was a couple days ago, will be counted as March payments. So there was a slight delay in that. I will tell you that I am working on something that I hope would extend and carry over our values from 2019. I have heard that, because they value all of our properties, our businesses, everything as of January 1st. And I have heard from the CAD that those values went up in 2020. We cannot afford that right now. So I am working on something that would carry over our 2019 values. Fingers crossed, wish me luck. We got to do that. But we really got to do better than that because, at the end of the day, people have less. People are losing their jobs. Their businesses are making less money. People are struggling to survive and provide for their families. So my opinion is that, look, the state can't print money, but what we do need to do is cut our taxes and spending to match the decline in our economy. So if that means, 25% decline in personal income, I don't know the numbers yet, but if that's what that means, And the state needs to cut taxes and spending 25%. And the same goes for local government. Same thing. So for property taxes, I would say, look, you know, everybody's living with less. People are hurt. They've lost their jobs. We need to help them in the best way we can without taking on an incredible amount of debt, because the state can't. And local government really shouldn't either, because the way that they pay that back is through bonds, you know, and that's property taxes. So I would challenge local government to do the same, you know, cut taxes and spending to help people in this crisis. And we don't have the exact numbers on that, but go ahead and make plans. Figure out what your core services are as local government. State government's going to do the same. We need to figure out what our core services are, because another way to help people, that's another tool on the table, is cut their taxes. And when you cut taxes, you got to cut spending, because if you don't cut spending, debt goes up and someone's got to pay for it, you know. So that's just how our state and local government works. You know, federal government's different. You know, they can work through the Fed to get these programs, the $2 trillion programs done. We can't operate like that at the state and local government level. So best tool we've got in our toolbox at state and local level is cut taxes and spending. So I'm going to push that. We need to do that. It's the right thing to do. You know, at the bare minimum, they need to adopt what I call the no new revenue rate, which means they don't take in a penny of more revenue of last year compared to this year. I mean, that's the bare minimum, but really we should cut taxes. I mean, that's what we need to do to help people. People just can't afford to pay the same taxes they paid last year. You know, we just can't. We cannot afford that. So these are some of the things that we need to do moving forward. It's a fight we got to fight, you know, and we got to help people. So that's really one of the biggest things we can do to help people at this time. And you know, you can definitely count on me to do that. And I can't promise we're going to win all of them, but I will definitely
We'll win some of them. Maze, while you're on the flood insurance, and then I'll ask these other questions, I had a conversation with a member that was so concerned. She got a 4% increase in her flood insurance, and she's with NFIP, not a private insurance company. And what she was told too was that, yes, you would have up to 6 months to pay the premium, but as we're entering into hurricane season, God forbid, we have to face that those claims are, they will help the ones, in other words, if we've got claims through a hurricane who are paid in full and not those that have not. So I want to look into that. Yeah. But she was concerned because it's like, oh my gosh, I need the time. But that if they were going to process the paid in fulls first in the case of a hurricane, then you don't want to do that. And so they're fearful. They don't know what to do because you can't, her business is completely shut down, a salon. So anyway, if we could, let's look into that further, because I don't know the answer, but if you could, I know if she's hearing it, probably lots of other people are.
Yeah, so, yeah, I'd be happy to. I had not heard that.
Yeah, that was the first time.
Yeah, that doesn't sound good. We gotta work on that. That's, you know, we are.
Yeah, because you don't want to be at the end of the line, you know, right, because you hadn't paid in full. I've got a question if you're ready. Are you ready? Yeah,
I think I'm about ready for questions. I'm sorry I went a little over on my time here,
this
but
was fantastic.
Absolutely.
We've got a question that
interrupt, Gina. Anybody else that has questions, on the chat, use the chat box and we'll get to your questions after Gina's done with hers that she's received.
Okay, one has the state had any discussions about the suspension, temporary, of our First Amendment right to assemble and worship? It appears the federal government has now instructed us how, when, and where we can gather or worship. It's a slippery slope.
We have, so that's why Governor Abbott clarified his order. So you saw some counties outright banning churches and saying they can't even open the door no matter what. And they needed to shut down immediately. So Governor Abbott clarified those orders and said, look, you can't ban churches. You can't put out an order that shuts down churches. That's unconstitutional. We do have conditions on that, though, of social distancing and large gatherings are still not allowed. You know, so I guess that's what the question was really about, and that's really a legal question. I think most people would follow that regardless. I don't think they need to be told that. Most people going to church in this crisis most are going to stay home
Right.
and watch the live stream. And the ones that do go are probably going to be part of the worship team or music or whatever, something that is part of the service. So I agree. You cannot say churches are closed. You can't do that. That's unconstitutional. The question is how far can you go in setting the conditions, right?
Right.
And I think Governor Abbott struck the correct balance here and said, look, just follow the common sense social distancing rules, and we really can't enforce anything beyond that. So I don't think anyone in our community is going to be giving anyone tickets for going to church. So that's the good news.
Okay, next one. Thank you. Question. My question concerns the local commercial fishing industry. The CARES Act contains $300 million earmarked for this industry. How and when can local fishing businesses expect access to this resource? We've already applied for PPP and EIDLEA. Commercial fishing depends heavily on restaurants to buy product and will not be able to start back up until the restaurants are up and running.
Right. Now, I mean, that's basically the textbook case for the PPP. I know I've talked to a lot of commercial fishermen that, are hurting right now, and I've seen the demand go down significantly. Charter fishing, we all know, are shut down as well. Pretty much anything except personal fishing is shut down at this point. It's something we got to make sure we get right. It's very important to our community. It's very important to our Gulf Coast economy. I really believe that the PPP is the best option, to be honest. And then they may want to look into a SBA loan as well. That's a longer term loan. It's 30 years. The PPP is 10 years max. The forgivable part is it only covers an 8-week period through June. So they may want to look into the SBA loan program, which is a longer term deal. And I have heard that that's slow right now because the SBA loan program is not administered by our community banks.
Right.
That's administered by the SBA. So we're trying to speed that up. I've heard from a lot of people saying, when is this going to happen? Because, a lot of people did not get their $10,000 in 72 hours, their grant. We're working on that. I know it's a big issue right now, and we've got to make sure this gets sped up here because people really need it right now. I mean, they've got to stay in business. They've got to keep the lights on. They've got to keep people employed. They got to keep their boats. They got to pay their mortgages. They got to pay their debt. That's what you got to do. That's part of business. So I'm here to help. If you're hung up in that process, it is federal, but I've been able to dislodge some of those applications. So I'm definitely here to help you, and please reach out to me in my office, and I'd be happy to work on it for you.
Perfect. Lorraine, do you have, we have questions from the chat room?
We do. First one is, I have a question as it pertains to unemployment. My daughter works for Saltgrass. We've been told that since Fertitta furloughed his employees, they are not eligible for unemployment benefits. Do you know if that's true?
I'll have to look into that. I believe if you are furloughed, you are eligible.
You are eligible. We know the answer to that question.
Yeah, that was a clarification that I saw not long ago. Now, of course, the recommendation is not to reduce salary during this process and not to reduce hours, which is a de facto way to reduce salary, because you're eligible for the payroll tax grant. But if you do that, that will compromise that. So, it's important you're going to get reimbursed. Keep people on their full hour, their full payroll. And once we get to the end of these programs, we can reevaluate. But for now, that's the official recommendation: is keep people on the payroll and don't reduce their salary. It's the right thing to do. And yes, if you are furloughed, you are eligible. So many have been furloughed.
Yes.
It's terrible what's happening right now. I just have never seen anything like it before.
No.
You know, and we I do have a phone number here for y'all, and I don't know if you have it. And that's the one I gave earlier for the our call-in, you know, for our time, because we're an area code that starts with 4, and I just wanted to make sure everybody had it. You know, it's very important to have. And 1 second, I just misplaced it here. I'll get it here.
That's okay.
It is, oh, and here's another important one while I'm looking that up. So Health and Human Services also has a 24/7 mental health support line. The good news is finally, I believe all private insurers and all of the state Medicaid, Health and Human Services are now approved to do mental health telemedicine. So the last hang up in that was Blue Cross. They finally changed their policy, I believe, on Friday. So before they required in person, which is crazy. You know, why would you do that right now? You know, that doesn't make sense to force someone to meet in person for their healthcare services. So anyway, Blue Cross changed that, and I'll give you all that number. It's through the Department of Health and Human Services. It's 24 hours. These are mental health professionals. It's free. The number is 833-896-1919. So I hope y'all got that. 833-896-1919.
That's
and then
good.
I've got the phone number here for Workforce Commission. It is 1-800-939-6631. And hopefully after this Thursday, when all of our offices are trained up on processing these unemployment benefit claims, we'll be able to speed that up a lot. You know, I mean,
Such a good idea.
Yeah, we really, it's, you know, it reminds me of, you know, the Victory Gardens or the things we did, you know, in wartime where, you know what, we should use, you know, the legislative offices to process these claims. You know, I mean, if they have a spare moment, that's what we should be doing, you know, because this is unprecedented, and, you know, we got to work hand in hand here to help people. So.
Maze, we have about 11 questions still. I don't know how much time you have.
Well, we've got another at least 15 minutes on the
Yeah, we're good.
So we're good.
From Catherine Hughes, do you know if Galveston County will be providing any grants for businesses? I'm aware that the city has received some funding for grants, but I'm not sure about the county.
I've not heard anything from the county so far. I do know that as part of the bill, the stimulus bill, and I'll go through that here in just a second, there was a significant amount of money for state and local government. So as part of that, there were grants, and I'm going to have to get clarity on exactly what that covers and the amount of money and those grants covers. But it was $45 billion. So the split on that is, I believe, about 50-50. So the state's probably going to get about half of that, and then local government will probably get the other half. I believe most of that, though, is going to be directed towards healthcare. So responding to this crisis, things like buying PPE, setting up, you know, triage, field hospitals, testing, you know, that's a big one as we work through this. And later on, hopefully sooner rather than later, the antibody testing, you know, so people know if they've had it, if they're immune to it, and that will definitely give us a much better picture of what's going on and what to expect here. So no, at this time, I'm not aware of grants that would go directly to businesses through the county. I'm only aware of the federal grants to the county and to local government, including the city, you know, at this point, through FEMA, by the way.
Mace, while we have a second, don't you think that Dr. Raymer and that whole team, I know that you're probably on with them daily, But don't you think they've just done an extraordinary job? We just couldn't be prouder.
UTMB, yes, it's amazing the job that they have done. They were very proactive.
Yes.
I mean, every time I call them, they've kind of already thought of it. I mean, from thinking of places to quarantine people, if we ran out of space, thankfully so far we haven't had to implement that, but they have these plans in place, and they were thinking about it back in January. Not only that, they're making strides in developing a vaccine. So, we have a first-rate medical research facility here at UTMB led by Dr. Raymer, and they're moving quickly on developing a vaccine. They're also moving quickly on developing antivirals. That's the thing that really will help the most people in the shortest amount of time, as it's sort of like something like Tamiflu, that compresses the amount of time that you have symptoms and makes you feel better faster, lessens the symptoms. I mean, that's really the thing at this point that would do the most good. And UTMB is leading the charge on that. And y'all have seen their field hospital that they set up, in order to keep people with symptoms separate from their regular ER, because, we still have people that have heart attacks and car accidents and, all these normal things that happen. And they thought proactively to take care of that and mitigate that risk of exposure. So Dr. Raymer has been working tirelessly. I bet y'all get the emails too. I mean, they send out about a 4-page email every day on an update.
I wait for that.
Yeah, we all do. It's and we're headed the right way. We're flattening the curve, thanks a lot to their efforts and leadership. So, and they've been great to work with City of Galveston as well. So
yeah, City of Galveston's done great. For those watching that may not be members of the chamber, you can go to our website, and Lindsay Touche has led that effort in sort of collecting all of this information, our whole team, and putting it within that website. So if you have any question, that literally is updated hourly, and sometimes, by the minute, of just new information coming in. So it's a really great resource, a one-stop place, really, because it's coming so quickly that you could probably find your answers on. So make sure and check that out. Other questions, Lorraine?
Got lots more. Are there any studies you're aware of that someone who has taken HCQ for years can volunteer for to determine its effects on contracting COVID-19? UTMB Research Department is not doing such a study.
Well, I do know they're administering that medication at the resort in Texas City. Dr. Robin Armstrong, that y'all saw him in the paper here about a day ago. So that's a real-time test right there that's happening right now in Galveston County. And, those are very, very high-risk patients. It's devastating that the virus got into that facility. So hopefully we see some much better outcomes because of that medication. And I do know of our good friends of Frederickson's here on Galveston Island.
Kathy and Chris, hello.
Yes. So they have a lot of research showing that zinc will prevent, in individuals the virus replicating, and it protects against, basically the catching. Zinc is a good proactive thing to do. And they're going to do a study on the zinc levels of patients that have had this virus to see if there's a clear link that they believe is there. So shout out to Chris and Kathy. If you need some zinc, call them.
They dropped some off to me. I love it. I take it every day.
They have zinc tea and other things too.
Yes. So. Cookies, all kinds of stuff. Other questions?
All right. Is it possible to have a checkpoint on the causeway to reduce Houstonians and out-of-staters flooding to Galveston?
So the checkpoint's been discussed. Right now, I'm just not really seeing, there was that car parade, I think, this weekend that GPD shut that down and told them to leave. But I mean, by and large, the streets are empty. I'm not seeing, Houstonians flood down here. I'm not seeing really anyone from out of the area come down here. The state would have to do that. So TxDOT, and it's not really set up. I mean, here's the thing with the checkpoint. So it takes time. So if a doctor or a nurse is stuck in a checkpoint line and someone passes away at UTMB because they're stuck in the checkpoint line, is that really something we want to do?
Good point.
You know, and I've heard that may be the reason why we want to reopen the beaches is put in a checkpoint. I think that there are ways to reopen the beaches without having that flood of people from out of the area, like, you know, close the parking areas, close the seawall parking. You know, I mean, if you do things like that and enforce social distancing, then I don't think we're going to have issues if we reopen the beach for, you know, people from Galveston exercising, walking on the beach. You know, and the GLO did have to sign off on that. That was a question I got earlier by email. So yes, we do have an Open Beaches Act. The beaches can be shut down in a disaster, like after hurricanes, they are shut down, but they do need the sign off from the Parks Board and the GLO. So the GLO must sign off on that. They did. I think there's a way that we can reopen them though without having, you know, everyone come down here, because we're the only game in town that's open. We've seen it in other areas, like Port Aransas, I believe, closed their beaches to everything except exercise. So you can't camp on the beach. You can't sit on the beach in a big group, but you can walk on the beach, you can exercise on the beach. And, you know, that's what we should be doing, you know. It's the right thing to do for, I mean, a lot of people have been in the house, and you think of the width of a sidewalk versus the width of the beach, right? I mean, you know, it's obvious which one you can practice more social distancing with. So,
here's a couple of questions, same questions. How does one get tested if they experience symptoms?
So right now, I would recommend going to UTMB. New update from yesterday is the city of Galveston and I were talking, and there are plans for public testing sites on Galveston Island and then the mainland also. It's like drive-through testing. They're not available yet. But if you do go to UTMB to get tested at this point, you do need to show symptoms. That's still a threshold. If you feel fine, you know, just want to be tested, they're probably not going to. So I would recommend going to UTMB if you want to be tested. They're the right place to go. They were the first ones to get tests. It's my understanding that they got the results down about 30 minutes now. Is the quickest they can do it. So they're leading the charge on the quick tests here on the island. So we're lucky to have them.
I wanted to stress too, Hospitality ER Health is also a member, and they had called me and asked me to come out and video, because a woman had come in and she just kept saying, I'm so sorry, I'm here, but my chest just doesn't feel right, and I'm having a hard time breathing, and my shoulder hurts. It was like everything, heart attack. And she was apologizing for being there, and she indeed was in the middle of cardiac arrest and did not think she needed to go, and felt so horrible because she didn't have COVID, and they handled her. And then immediately she went over to UTMB. They have a great partnership. Just really want to stress though to people, same thing with someone that had been cut and wasn't going to go in and seek treatment. We're still going to have issues, you know, medical issues, and we know our bodies, and we still need to go and take care of each other and take care of ourselves. And so they had asked me to get that out because she could have died staying home, feeling horrible to go out, or scared that she was going to get COVID. So it's important. We know when something's not right.
And our medical facilities have plenty of capacity for that. We've still got plenty of capacity because we canceled, you know, all the non-essential medical procedures. You know, I've heard from a lot of people that have gone in, and they said, you know, there are lots of beds. There's lots of availability because we planned ahead, you know, so please don't be afraid to go in or call 911. And then the other really great thing we've seen is the waiver of a lot of regulations for our healthcare industry that Governor Abbott has done. Telehealth has been dramatically expanded. It's great. It avoids people from having to go in and be exposed. Like speech pathologists even can now do, you know, telehealth. So, and we're trying to get speech pathologist assistants, you know, I mean, all this broad range of services that we can now do by telehealth. And then, you know, things like that, that we can really help a lot with in Galveston. Like now, we're allowing nursing students to help in our healthcare facilities. Those that haven't graduated yet or gotten their license yet. I mean, and we have a lot of those. We have top-notch nursing schools here on the island, you know, and we're able to help. We're able to put extra hands on deck. And those are some of the regulations that have been waived so far. You know, we've also waived a bunch of the regulations with EMS personnel, allowing physicians, assistants, and doctors, you know, to directly dispense medication. You know, even little things like allowing the beer delivery trucks to deliver groceries. For some reason that was against the law before, it's not anymore, you know, I mean, so I think there are a bunch of regulations that have been waived that we really need to go back and see what can we get rid of here, you know, I mean, because it's really been great to see all of that, everything in the way, you know, of providing medical care and essential services and groceries, all those regulations, slowing that down and adding time go away. And Governor Abbott has waived a tremendous amount of those. And I also wanted to point out one thing that's really important. I think it's been highlighted. I think I sent an email about it a little while ago, but it's the Comfort Food Care Program. So, you know, we have a lot of families struggling right now. We have a lot of restaurants struggling. And this is sort of the marriage between those two. And it's the Comfort Food Care Program. And it's for families that are in the Texas Network of Family and Youth Success Programs. So it used to be called the Services At-Risk Youth Program. And so when you order to go, I would encourage every restaurant on the island to opt into this. They can do this through the Texas Restaurant Association website. So if any of you order to go and the restaurant is in this program, you can add to your order and they'll deliver a meal to a family in need.
Oh, that's
so it's a great way to support your local restaurants.
Yes.
It's also a great way to support families in need. So I would encourage everybody in the restaurant industry to make sure your restaurant is in the Texas Restaurant Association list, you know, of available comfort food care vendors. And just whenever you order something to go through Favor or Waiter or any app or online, I'd recommend, if you can. I've done it. It's important. You know, people are hurting right now, so this is a great way to give them that hot meal, you know, from a good restaurant that they definitely wouldn't have had otherwise.
It's been so wonderful to see people in this community step up time and time again and buy those gift cards. And I was blessed to be able to deliver 15 gift certificates to the families of Upward Hope. I gave them to Chris and
That's
Kathy.
awesome.
They were doing it, but Gary Coffran from GIA bought the certificates from Mario's. And it's just one example of it happening just all over. You're supporting, you're injecting some money into that restaurant, but helping feed families. And just so grateful they donated some to the Salvation Army staff. So although people are suffering, we're Texans and we rise to the occasion. And if anybody can get through this, it's us. And it's because the leadership of you, Mays Middleton, and Senator Taylor, and Dr. Greg Bonin, and, you know, our Senator Creighton and Congressman White, you know, we have these strongest representatives that were fighting for us every day. But now I just have so much faith in our governor and our representatives that we'll get through it. You know, we're going to get through it and we'll come out better. But helping each other understand it and all this information coming to us is so important right now because people are scared. And I appreciate you for
Thank you for all the chamber is doing. It's been amazing to see, you know, how hard y'all have worked in this crisis. And this is about, you know, helping each other. And you do that. There's so many things available right now, but the volume of information is just incredible. You know, it's hard to tell what's what, you know, out there. There's just so many things. And y'all have really centralized it in an easy to understand way to help people in our community and help the businesses in our community. And really give them the tools that they need, you know, to succeed and make it through this, because we're going to make it through together. You know, Texas led our entire nation out of the Great Recession I am confident we're going to do it again this time and lead the nation out of this crisis. So I've been proud of our state's response. You know, we're good at it. We got Texas grit, you know.
Yes.
We don't, and especially on the Gulf Coast, we have Gulf Coast grit because we've been through plenty of disasters, you know. So I know we're going to get through this and figure it out.
Help each
I'm here
other.
to help any way I can.
Thank you so much. Lorraine, did we have time for one more? It's 11 o'clock. You want to slip one more in before we?
Sure, one more. We can do one more.
Okay.
Well, you had mentioned about the restaurants, and the question is, and you may not have the answer, we may have to provide the answer, Gina, and that is, where can I get a list of restaurants that are participating in this program that you mentioned? And I know Mosquito Cafe is listening, and James said, he sent it. Excellent. Never mind. James just sent the list, so we'll make sure we get that out. And then you guys, we are recording this session, so we will be sending it, we'll be putting it on our website, and we'll also have it on our YouTube channel. So Lindsay, do you want to speak to how someone can reference this recording tomorrow?
Sure. It'll be in the COVID newsletter, which will probably go out tomorrow. And then it's also available on our YouTube page at Galveston Chamber.
And another thing is, if you go on our website now, everyone, and please help us share this, and on Facebook, please share this, because I'm doing Facebook Live now too, is we have created, Lindsay and our phenomenal team, literally a virtual mall. And so you can go on there and you will see all of the restaurants. I mean, every day my team is most of them working out of the house, but they're calling. We've made calls from over 600 members, Maze, and talked to them. What are your hours? What do you need? How can we help you? And all that. But that we have a comprehensive list and sort of this virtual mall now that you can go into and find a service and find out information about them. And it's not just the restaurants. We do have a very comprehensive list of the restaurants, but it's our retailers too, you know, that are suffering greatly. And so you can go on that site. What I was just telling some people yesterday is we're all still having birthdays. Thank God. And we're still celebrating anniversaries, and we're still going to celebrate Easter, some of us. And, you know, there's still time and gifts that we're going to buy. So go on these virtual malls. I'm bombarded with Macy's and big box stores every single day, and I just delete it. And I go local, but that's sort of how I live my life every day. But go on there and buy your gifts from this virtual mall, this shop local. You might think your gift doesn't make a difference, but if 100 of us do it, Maze, it makes a difference. It does. You know, and so go buy your gifts there and shop and think ahead and get gift certificates and stuff now instead of maybe 4 months from now. And all of us doing that could make a difference on whether a business survives. So go on there. It's really cool. Lindsay's done a phenomenal job of putting that together. And so, Mace,
I've done a great job featuring small businesses too, you know, every day.
I'm trying. I'm getting ready to go to Katie's Seafood. They've got an exciting announcement, and I'm going to go over and video them. And Mace, thank you so much. Thank you to everyone that spent this hour with us.
Thank you all. Thank you for having me. You know, and I'm here to help any way I can, 24/7. You know, we're going to get through this together. And if there's anything you're having an issue with, or there's so many programs that you can apply to, and it's not going to go off without a fault. We know that, you know, and I'm here to help you with that.
And Representative Middleton,
make sure you get the tools you need.
Yes. What we'll do too is maybe go ahead and reschedule another one of these in a couple of weeks. Perfect. We're going to be looking differently then, and maybe with some much better news. And so maybe we'll go ahead and do that. We'll get on everyone's calendar and we'll just give an update. I don't know if we need to do it next week, but maybe the next. But whenever you're available. You're going to be working on unemployment. So
yes.
I'm going to be busy. But thank you so much. Thank you, everyone. If you have questions, you can send them to us. We'll make sure that our representative gets them, and everyone have the best day that you can. We're committed to bringing this region and Texas back in our country. So thank you, friend.
Thank you all. Appreciate it.